So now I'm absolutely thrilled to introduce our new speaker, who's Sir Ciaran Devane, who's the chair of the HSE Board. Most recently, Ciaran was CEO of the British Council. He's had an illustrious career in the UK, and you're working with Macmillan in one of his roles. He's a strong supporter of the digital transformation of the Irish healthcare system, and I think he's done a really tremendous job chairing HSE Board in terms of what has been probably one of the most difficult years, without doubt, in terms of the HSE's existence. So without further ado, I'll pass you to Sir Ciaran Devane, and thank you, Ciaran, for joining us today.
Martin, thank you. Nice to be here with everyone. So what I thought I'd do is just talk at you a little bit around the kind of, the view from the HSE Board about where we're going, and then maybe talk a bit about, all things digital and data, and maybe refer back to some of my experience with Macmillan, as Martin said, and with the NHS, NHS England, which I was on the board of for a while as well. But the starting point for me is that if you go back to just pre-pandemic and you took the European Commission OECD's latest monitoring of the Irish healthcare system, it would have told you a few things. One of them was that the fastest improving life expectancy in the European Union was Ireland. So every 4 years, the average life expectancy went up 1 year, and this has been going on for a few decades now. And the second thing it would have told you is that the population of Ireland self-reports the best health of any population in the European Union. So the HSE and partners were certainly getting something right. But we all know about the trolley stories, waiting times. What was happening was the system was doing a great job. People were living longer, but turning up, to be looked after, and the capacity wasn't there to meet that demand. So something's going absolutely brilliantly, but the system was at its limit, because fundamentally, like many Western European systems, the HSE was set up to fix people. You have a problem, you go to the GP, they give you an antibiotic, you go home. You break a leg, you go to A&E, they fix you, you go home. But increasingly, as we all live longer, then we will have multiple conditions for many, many years. And it isn't about fixing people and sending them home and not hearing from them again. It's about managing, the comorbidities over a sustained period of time. And the system, like many others, has not been designed to do that. So hence all the stuff that you read in Sláinte Care, and which is a great document. And the most recent interpretation of that from a HSE point of view is to be found in the corporate plan, which was published 2 or 3 weeks ago, which I'll just talk you through very, very quickly, some of the highlights. And if you only read one page of the corporate plan, there's one which looks like this, which has the graphic, which basically captures the essence of the strategy if you do only want to look at one thing. The first thing was, we said we would, for the next few years, we would set up 6 objectives, 6 things that we would change. And Martin uses the phrase, keep left, shift left a lot. So that, and that's the underlying philosophy, I think, maybe behind the corporate plan. So the first objective was manage the pandemic. And the first, maybe the most important thing to say about that is thank you to everyone, because we wouldn't have been able to handle the pandemic as a nation if it wasn't for everything that everybody in the HSE, including yourselves, have been doing, whether it's the increased use of remote monitoring, the remote clinics, whether it's the data lake, which allows us to interrogate what's going on with test and trace, increasingly what's going on with vaccine and so on. That has been absolutely essential. The other aspect that we have to get right in handling the pandemic is reopen the other services, because obviously, there is a risk that people, if a service isn't operating, then obviously, conditions could get worse. Equally, sometimes the service is open, but people are anxious about turning up to hospital. So we have to get those right as well. The next priority is around getting it right in the community, because the increased population of older people who will have multiple conditions are best looked after at home. So therefore, we need to be shifting diagnostics into the community. We need to be allowing GPs to have direct access to those diagnostics. We need to be thinking and doing things in a different way. The third one is tackling waiting lists, making sure that scheduled care happens in a timely way. Again, that links into the community, but it also means that we have to find ways of ensuring that people can pass through the hospital system as quickly and effectively as possible. And then there are two which are fairly similar. One is around mental health and the other is around disability services, making sure that we take a much more individual, patient-centered, person-centered approach to how we handle things. Fewer congregated residential settings, for example, allowing people to live at home because the support exists in the home. So, a good example of one of the things in the corporate plan is that there'll be 96 community-based multidisciplinary teams with a population base of roughly 50,000, being able to deliver services into the community to the cohort of older people or people with disabilities as needed. So a different way of thinking about things. And then the sixth one is some of the areas that the same European Commission OECD report talked about where we're a laggard around some aspects of children's health, alcohol harm, obesity. We have other things, better things that we need to be doing. So the strategy going forward envisages a HSE and a health system which will be very different to the one which historically was developed through effectively the 20th century. So getting that right will be important. Now, how to do that is where you come in. We talk in the strategy about key enablers, the things that have to get right if we're going to allow anything else to operate. Patient safety, making sure that we minimize adverse events through great clinical governance, for example. Communications with the public. One of the things which COVID has shown is that the HSE is a trusted source of good public information and public health information. We need to continue to do that. Improving the infrastructure and equipment that's available to the staff of the HSE and the system more widely to do the right thing. But then the ones which really have the potential to help with the transformation. And that's about data, it's about eHealth, technology, things which will allow us to do things in a completely different way. If I think back to my time running Macmillan Cancer Support, we did a lot of work around data to get that insight that David was talking about just beforehand. We were looking at, for example, the population of people who had colorectal cancer surgery, and we were able to identify what conditions they had 5 years after the initial diagnosis in a way which had never been understood before. So 24% of people who had an operation 5 years ago had incontinence. Nobody knew that. So therefore, we were able to go to the system and say, we need to make sure our incontinence services are triggered very early so that we prevent the 24% of people developing long-term incontinence problems. And that's what the data was allowing us to do, things which absolutely changed the experience of people and the prognosis for people with various conditions. Some of the caveats, I think, which were lessons learned through life in the NHS. One was around privacy, and I chaired an advisory board for a program called Care.Data, which had run into trouble because it was about linking primary care and secondary care data to drive the insight that we've just been talking about. But of course, it's very easy to get to a position very quickly by linking databases where the individual is identifiable. And one of the weaknesses of the position was that the privacy lobby very rightly were concerned, but also they were saying, you're asking for all this extra access to data and extra things put into your data lake. but you're not demonstrating that you're using the existing access and the existing data you have for public benefit sufficiently. So one of the key things I think as we go through is to make sure that all these innovations that we put in place, particularly around data, we are seen to demonstrate the public benefit of them, as well as safeguarding on the privacy side. The second lesson was more on the tech side and more on the innovation side, was a recognition that everything good was happening somewhere in the system, but never being rolled out. So things which had been invented in, say, Basingstoke, which happens to be local to me, 5 years later might be all over Scandinavia, but 20 years later hadn't made it in the roads into London. Not because they weren't great innovations, but because the system wasn't in place to enforce the uptake and spread of innovation. And you got into things like, some of the eminent hospitals saying, well, nothing ever good came out of Basingstoke, so why on earth should we listen to them? So the next thing was around saying, getting these digital transformation, these digital innovations taken up, really needs to manage the kind of what we used to call a community of influence. Who are the people who will own this, love this, sell this idea across the system? So one of the things Martin and I have talked about is making sure that we have that in place. So it's great to see that the remote respiratory monitoring is in 15 acute hospitals, because that's where we have the impact. Doing the great thing, getting it out of the digital lab and spreading it across the system is really, really important. And then my last point, and then I'll stop, is to say, I believe now's your moment. You have demonstrated through the pandemic the benefit of many of the innovations. I think we're all bought into the scope for doing things radically differently. Money is in the National Service Plan for this year, and if we do a great job this year, then the money for the other things described in the multi-year plan, the corporate plan, then that will be easier to get from government if we demonstrate the benefit of the things that we have the funding for 2021. So just to close again by saying, reiterate the thank you. I think what you've done over the last year has been tremendous. I don't think we could have managed through the pandemic without the innovations that you as a community have put in place, and you as a community have delivered for the wider system. So thank you. I think now is your time. Let's make sure we have a great 2021 so we can extract more money from deeper for 2022 and beyond. I'll stop there, Martin.
Great, Ciaran, that was a fantastic talk. And just maybe one question, actually it would be great if we could open it to everybody, but I think we're too time constrained. And digital as a technology, do you see that as one of the key armory of tools that will help the HSE and other health systems transform, or is it more an enabler? So is it a transforming force, or is it an enabler?
I think both is the answer to that. I think when we were doing the work on the corporate plan, and this wasn't a small group in the centre doing the corporate plan, this was engaging with stakeholders, engaging across the system, and we said, what are the things which will truly make a difference? Well, med tech, eHealth, data were the things that kept coming back at us. The second area that kept coming back at us was great communications with the public, building the trust and confidence with the public, with stakeholders, and they were really the two. So if you do get around to reading the corporate plan, they are there as the critical things, the critical success factors in project management jargon, which we must get right, because only then will we be able to do all these other things we've been talking about. Because we really do need to, as David was describing, to really understand, the digital twin, and to be able to say, we really understand what's going on here. Because in the 20th century systems, which most countries are living with, you only understand the bit you see in front of you. What this will allow us to do is see the whole story. And medics will tell you about the importance of the medical history. Well, Yeah, we can have great medical histories if we get this right going forward.
Great, thanks. Thanks very much, Ciaran. Thanks for such a clear and lucid talk, and it's great to have somebody of your caliber at the helm of the board, and it gives us the confidence to innovate.
You're only saying that, Martin, because we were in UCD engineering together.
Well, that too, and it's brilliant to have the opportunity to collaborate with you again.
As ever.
Great, thank you very much, Ciaran.
Goodbye all.
Thank you, Ciaran.